Thank you very much. My name is Magdalena Dąbkowska, but that's fine even in Polish that my surname is often changed and mispronounced, so no worries at all. Thank you very much for the invitation. Good morning, Europe. Good morning in Warsaw. And I very much hope it will be a good and safe morning for our neighbors in Ukraine. We think a lot about them these days. It is a very specific moment in time, a new era, as Marco said, that we are meeting in. So to be honest, I stayed until really late last night, trying to figure out what actually I should be speaking about today and what I should be sharing. But in the end, I decided to stick to my field of expertise, which is drug policy, a very complex and complicated issue, misunderstood often, by many perceived as controversial, which is the intersection of numerous themes. When you think about drug policy, this is about our freedoms. This is about the access to adequate treatment for a number of patients. This is about public health and about the tension between the public health and a more security-oriented attitude. But this is also the field that has taught me a lot. And I decided to share 5 lessons learned from drug policy that I believe might be relevant for the conversations that we will be having today and tomorrow. So lesson number 1 is actually a sad observation that I bet some of you would share, that often when decisions are to be made, especially regarding the themes that are, again, complicated, misunderstood, sometimes perceived as morally dubious or treated by politicians as a hot potato, or the other way around, the ones that you can politically gain something on, then unfortunately, quite often what we see is that evidence is neglected, science and data is put aside, human rights, for God's sake, are not taken into account. And then we as citizens risk having the laws, policies, and regulations that actually target a number of us, that in the name of the public good, in the name of our security, in order to protect citizens' health and safety, actually some of the citizens are targeted, even criminalized. It can be a woman who needs an abortion. It can be a person who uses cannabis for different reasons, either for relaxation or for medical purposes. So some of us are then targeted by these laws. And it's not only that. It is that these laws are applied unequally. So it really matters whether where you're born. It really matters which district of the town you live in. It really matters what is the color of your skin, what is your cultural background, what is your country of origin, and then these laws may even be applied differently. So at a certain point, it becomes clear and apparent that reforms are needed and the shift of the policies is needed. Clear to whom? And this is lesson number 2. It's not always the decision makers or the politicians in power who have this clarity. These are often the citizens, the civil society, either in organized matter like foundations, associations, organizations, or informal groups and communities, activists. But they are usually the ones who first realize something is not working here. They are often the ones, or you're the ones, who are bold enough, passionate enough, compassionate enough, innovative, etc., to propose new solutions. And when it comes to drug policy, we do have a number of countries in Europe that today are praised for their good policies. Reasonable, cost-effective, rooted in public health and human rights, like Portugal, like Switzerland. But when we look back in the history, actually these were the groups of inhabitants, of citizens who came together, who were innovative enough to propose new solutions to the old problems. And then these solutions actually were leveraged to the level of country-wide policies, laws, etc. But it started with citizens. 2 years ago, when the pandemic started and new emergencies started in the drug policy field, we saw the same. Who was the first one to respond to the emergencies? These were communities, these were organizations, groups that really went out of the streets and were at the forefront to deliver their services, to deliver help, to really care about those who are quite often forgotten by the state, easily forgotten, easily marginalized. And this is not an example from the drug policy field, but it's hard not to mention it today. What is happening in Poland these days? We have over 1.5 million war refugees coming from Ukraine. And as it was said, unfortunately, this is not the state that coordinates the humanitarian aid. These are not the state institutions that provide that help. These are ordinary people, volunteers, NGOs, to some extent the local authorities that do that. Unfortunately, the bureaucracy is too slow, and for many, many reasons, the state is often a few steps behind the society and the civil society. Lesson number 3. I bet you've all heard about the phenomenon of the shrinking space for civil society. We've heard a lot about it over the recent years around the world. Last week, the Freedom House launched their new report, which stated it's been the 16th year in a row where we could see the decline of democracies around the world. My home country, Poland, was downgraded by the Civicus Monitor from the category of countries with a narrowed space for civil society to the obstructed one. And even among other European countries within the EU, we can see a number of challenges within the democratic systems. The undermined rule of law, attacks on media and media freedom, discrimination and mistreatment of migrants, a lot could be listed. And then let's think about these particular areas and fields like drug policy, but there are of course many others like women's rights, LGBTQI rights. Let's think about those fields where civil society plays the key role, is the main or sometimes the only actor. And when the space for this main or the only actor is getting limited and limited, what's going to happen with that issue? So we need to regain that space, and there's a lot to be done. Then, while doing this lot and regaining the space, I would like us to remember about the 4th lesson. I believe it was Professor Wiktor Osiatyński, a distinguished jurist specialized in the constitutional law, the co-author of the Constitution of Poland, who said that drug policy is like a litmus paper. Show me how your drug policy is framed. Show me how the groups who are mostly marginalized treated in your country. And then I will tell you what is the state of the freedoms in your country. What is the state of the democracy in your country? So I would really like us to be really, really inclusive in the conversations today, tomorrow, and in the future, to really leave no one behind. To think how our innovative solutions, our bold ideas, our visions would affect the ones who are easiest to be marginalized, forgotten. If we discuss an issue, let's make sure that people who would be mostly affected by these proposals are actually seated around the table. When we discuss abortion, for God's sake, we need women around the table. It's not obvious for everyone. When we discuss drug policy, let's make sure that people who use drugs, who use psychoactive substances, are seated around the table, that their voice is heard and taken into account. Let's use the rule, nothing about us without us, for all the conversations that we'll be having. And the fifth lesson, it comes from the human rights, because I work on drug policy from the human rights perspective, and I bet and I very much hope it is obvious for humans, is let's put humans in the center. All humans, including women, including transgender women, including people with disabilities, including people living with HIV, refugees and migrants. We think a lot about those coming from Ukraine these days, yes, but also refugees and migrants with black skin, but also the ones coming from Syria, Afghanistan, Yemen, and also refugees from Belarus and Russia who are here in Poland these days, who opposed to the regimes in their countries, had to run away and today are targeted by the hate speech. So what I'm trying to say, let's always put humans in the center. Humans and not labels. Thank you very much.